Welcome back to Med Madness, the podcast where we explore essential topics in medical education and practice. I'm your host, and today we're continuing our discussion on medication safety. In this episode, we'll focus on adverse drug events, or ADEs, in elderly patients and explore strategies to prevent these events. We'll wrap up with a case study to illustrate these concepts in action. Let's get started. Adverse drug events are a significant concern, especially in elderly patients. These events occur frequently and can lead to serious health complications. The elderly are particularly vulnerable to ADEs for several reasons. Polypharmacy. Elderly patients often take multiple medications for various chronic conditions. The average elderly patient takes around 8 medications daily, increasing the risk of drug-drug interactions and adverse effects. Physiological changes, age-related changes in body composition, liver and kidney function can affect drug metabolism and excretion, making elderly patients more susceptible to adverse effects. Increased sensitivity. Elderly patients may have increased sensitivity to certain medications, leading to exaggerated effects or side effects. Cognitive and functional decline. Cognitive impairment and functional limitations can affect medication management, leading to errors such as missed doses or incorrect administration. Common ADEs in the elderly include falls, confusion, bleeding, and kidney injury, often triggered by medications such as anticoagulants, antidiabetics, and sedatives. Preventing ADEs in elderly patients requires a multifaceted approach. Here are some key strategies to reduce the risk of these events. Judicious prescribing. Healthcare providers should practice careful prescribing, avoiding unnecessary medications, and opting for the lowest effective doses. It's essential to regularly review and reconcile the patient's medication list to identify and discontinue any potentially harmful drugs. Medication counselling. Providing clear, patient-centered medication counselling is crucial. Use plain language to explain new drug names, their purpose, dosage, and timing. Encourage patients to ask questions and clarify any doubts they may have. Interactive methods. Employ interactive methods like the teach-back technique, where patients repeat back the information in their own words. This helps ensure they understand their medication regimen and reduces the risk of miscommunication. Regular follow-up. Schedule regular follow-up appointments to monitor the patient's response to medications and make necessary adjustments. This also provides an opportunity to reassess the necessity of each medication. Pharmacist involvement. Involve pharmacists in the medication management process. Pharmacists can review medication regimens, provide valuable insights into drug interactions, and suggest safer alternatives when needed. Use of technology. Implement electronic health records, EHRs, with built-in alerts for potential drug-drug interactions, duplicate therapies, and contraindications. These alerts can prompt providers to reassess and modify the medication regimen before prescribing. Family and caregiver support. Engage family members or caregivers in the medication management process, especially for patients with cognitive or functional limitations. They can help ensure medications are taken as prescribed and watch for any adverse effects. A pharmacist reviewed the patient's medications and provided recommendations for safer alternatives. For example, the antihypertensive dose was adjusted to minimize the risk of hypertension. The facility's EHR system was updated with alerts for potential drug-drug interactions and duplicate therapies. These alerts help prevent similar issues from occurring in the future. The patient's family members were involved in the care plan, helping to ensure medications were taken as prescribed and monitoring for any adverse effects. As a result of these interventions, the patient experienced fewer falls and better overall management of their chronic conditions. The combination of judicious prescribing, medication counselling, interactive methods, regular follow-up, pharmacist involvement, technology use, and family support created a safer and more effective medication regimen. Let's bring these strategies to life with a case study from a long-term care facility. An 82-year-old patient with a history of hypertension, diabetes, and mild cognitive impairment was recently admitted to a long-term care facility. The patient was on multiple medications, including an anticoagulant for atrial fibrillation, an anti-diabetic drug, an antihypertensive, and a sedative for insomnia. The patient experienced a fall resulting in a hip fracture. On review, it was found that the combination of the sedative and the antihypertensive medication led to significant orthostatic hypertension, increasing the risk of falls. The healthcare team reviewed the patient's medication list and discontinued the sedative. Non-pharmacological approaches for managing insomnia were implemented, such as establishing a regular sleep routine and limiting caffeine intake. The patient and family members were counselled about the changes in the medication regimen. Clear instructions were provided regarding the purpose and timing of the remaining medications. The teach-back technique was used to ensure the patient and family members understood the new medication plan. They were asked to repeat back the instructions to confirm their understanding. Follow-up appointments were scheduled to monitor the patient's response to the new regimen and assess for any adverse effects. Blood pressure and blood glucose levels were closely monitored. In conclusion, adverse drug events in elderly patients are a significant concern, but they can be prevented through careful and strategic approaches. By implementing judicious prescribing practices, providing clear medication counselling, using interactive methods, scheduling regular follow-ups, involving pharmacists, leveraging technology, and engaging family members, we can reduce the risk of ADEs and improve patient outcomes. Join us in the next episode of Med Madness as we continue exploring more aspects of patient safety and human factors engineering. Thank you for listening, and don't forget to subscribe and share this podcast with your colleagues and friends. Until next time, stay safe and stay informed.